Hello everyone, welcome to House News. The House supports the government to grant Indonesian citizenship to foreign athletes. Increasing financial literacy has become a global issue which may affect the economic growth. The House is committed to giving legal protection for the customers through the draft bill of food and drug control. Indonesia policymakers are making fundamental steps to address barriers to healthcare through the revision of the health law. The House has been contemplating on creating an omnibus law for health sector regulations. A historical milestone for the people of Sorong Raya has been made. Indonesia is happy to welcome Southwest Papua as the 38th province. Commission 3 of the House, together with Ministry of Law and Human Rights, the Ministry of Youth and Sport, and the Football Association of Indonesia, have approved the proposal of naturalization for soccer player Shane Ilian J. Patinama. It is expected the naturalization process is immediately finalized so the Dutch football player can perform with the national team. Member of Commission 3 of the House, Rudi Masud, hopes the naturalization can bring more achievements out on the score pitch. In addition, Rudi asked for evaluation on contribution of naturalized players.
Pak Menpora adalah bagaimana tentang evaluasinya terhadap yang telah dilakukan dengan naturalisasi pemain-pemain ini untuk memberikan dampak yang baik, terutama untuk bangsa dan negara kita ini. Yang kedua juga sambil untuk bagaimana agar bisa meningkatkan kualitas kegiatan-kegiatan terutama adalah dalam rekrutmen, pelatihan dan semuanya untuk bisa meningkatkan kualitas atlet-atlet kita yang lokal. Inilah perlu dilaksanakannya naturalisasi, sekali lagi memberikan apresiasi terhadap kinerja kerja dari Pak Menpora melaksanakan program-program, tentunya saya yakin ini semuanya atas persetujuan dari Bapak Presiden, dan blueprint-nya menurut saya ini apresiasi kepada pemerintah, khususnya pada Pak Presiden Jokowi yang telah memberikan naturalisasi untuk percepatan-percepatan, perbaikan-perbaikan khususnya di PSSI ya.
Prior to Commission 3, the naturalization application was also discussed at Commission 10 of the House. The House Sports Commission also proved that naturalization of Shane Ilian J. Patinama, the session process went according to legal regulations. Andri, TVR Parlemen, report. The House has approved continuing the draft bill on the development and strengthening of financial sector, which was considered to play an important role in improving Indonesia's economy. The House hopes the draft can also increase financial literacy to encourage the community have better understanding towards financial systems. During the discussion of the draft law on the development and strengthening of the financial sector, or RUU P2SK, Commission 11 of the House emphasized the bill is aimed at the further development of Indonesia's financial sector. The House hoped the draft bill become a solid foundation to face the looming global recession and to maintain the economic growth amid the COVID-19 pandemic. Member of Commission 11 of the House, Indah Kurniawati, said one of the methods to strengthen the state financial system is by increasing financial literacy, or financial education related to financial system and the potential business development. As a result, people can increase the production and contribute to increase gross domestic product and also to open more job opportunities through MSMEs.
Sehingga mereka yang dengan segala sumber yang sangat terbatas ini mampu memproduktivitaskan dan mampu hidup secara efisien untuk bisa menjadi atau memberikan kontribusi bagi pertumbuhan ekonomi melalui sektor mereka masing-masing. Nah, tentu kami berharap seluruh stakeholders yang untuk dunia usaha. Sekarang yang kita dukungkan adalah dunia usaha.
Member of Commission 11 of the House, Muhammad Misbahun, added RUU P2SK is expected to provide a strong legal basis giving protection and access to community financial support. Ms. Bakun mentioned the draft should be able to stimulate local economy even when the COVID-19 pandemic hit.
Karena di dalam proses itu, proses terjadinya krisis itu juga kita mengalami situasi bahwa masyarakat butuh jaminan, perlindungan konsumen, ya kan? Perlindungan dari negara dalam bentuk aturan yang mau tidak mau harus kita berikan penguatan dalam bentuk legislasi primer.
Ferdian and Yoga TVR Parlemen report. The cases of harmful substances in food and medicine have occurred frequently in Indonesia. The case of formalin and borax illegally used in noodles and meatballs, the case of infant formula contaminated with Sakazaki bacteria, and the latest case of acute kidney failure due to exceeding amount of harmful substances in children's medicine are among the severe cases. The frequent cases of hazardous substances in food and drug in Indonesia shows weak administration and legal system regarding food and medicine circulation. Member of Commission 9 of the House, Sri Meliana, explained the draft bill on food and drug control formulates sanctions imposed to those who committed crime in order to avoid similar cases to happen. The draft bill is giving authority to the National Agency of Drug and Food Control, or BPOM, to administer enforcement to home industry using harmful contents in the products.
Jadi harus ada tindakan, kalau tidak gimana efek jerahnya ya Mbak? Karena yang kami ketahui itu di daerah-daerah seringkali dalam beberapa produk diketemukan zat-zat yang seharusnya tidak boleh ada di situ. Dan ini yang membuatnya itu skala industri kecil. Kita ceritakan aja misalnya mie mengandung formalin. Itu kan nggak boleh harusnya. Tapi kalau itu ada, maka si produsen mie-nya ditindak. Tapi kan ini rumahan. Di sini dia ditangkap, dia lari ke tempat lain. Nah, ketika ini berkali-kali terjadi, maka harus ditangani yang membuat efek jerah.
Sri Meliana added it is obligatory to give punishment for the parties using dangerous substances to medicines and food. However, it requires more substantially discussions of the form and type of sanctions in detail. Ken and Ade, TVR Parlemen, report. The Legislation Committee of the House explained the draft of the Omnibus Health Bill has been examining various health issues, starting from medical practice to the health insurance programs. The House intends to make integrations among all healthcare aspects in Indonesia. Sodik Mujahid says the Omnibus Law on Healthcare aims to combine, streamline, and overcome overlapping regulations. Sodik admits various reactions against the draft bill have emerged, assuming the draft bill is not pro-people. Therefore, the Legislation Committee of the House invites several organizations related to health sector to actively involve in the bill formulation.
Terhadap karakter Omnibus Law. Itulah maka kami sekarang dalam Omnibus Law Kesehatan mengundang sebanyak-banyaknya pihak organisasi yang terlibat dengan kesehatan. Ya, ada asosiasi rumah sakit, ada dokter, ada ahli kesehatan masyarakat, ada perawat, ada bidan, dan lain-lain. Nah, bagaimana sikapnya? Sikapnya mereka tadi kurang paham terhadap Omnibus Law sehingga khawatir. Nah, kami sudah menjelaskan bahwa justru dengan adanya Omnibus Law, maka lubang-lubang sektoral itu bisa kita integrasikan.
Sodik Mujahid points out the bill will not replace certain health professional organizations. The bill on health is a new proposal in the 2022 Priority Prolegnas and expected to provide reinforcements for health regulations which are currently still divided into various different laws. Fitian and Julian, TVR Parlemen, report. The Legislation Committee of the House currently is preparing an omnibus law for the health sector. With the law, it is expected the entire ministry and institution can cooperate with one another to create a more adaptive health sector. Firman Subagio said the omnibus law for the health sector has been formulated to improve existing health regulations. The draft bill on health summarizes all interests in health sector. The bill also highlights the right and responsibilities of the doctor service bonds and nurses in handling emergency patients.
Berikanlah dasar hukum atau regulasi terhadap perawat-perawat bisa mengeluarkan resep untuk tanggap darurat. Nah, tentunya nanti narasinya atau nomenklaturnya atau narasinya atau substansinya kita atur. Bagaimana mengaturnya? Tentang tanggap darurat itu seperti apa, batasannya seperti apa, ini yang kita atur sehingga betul-betul masyarakat itu yang membutuhkan pelayanan kesehatan ini akan terpenuhi sebagaimana yang diamanatkan dalam undang-undang.
Member of Legislation Committee of the House John Kennedy emphasizes inequitable distribution of medical doctors and specialists to be only focused on the cities. John Kennedy also explains the number of Indonesians traveling abroad for medical treatment is increasing every year. Therefore, the health bill is addressed to improve the quality of Indonesia health workers and upgrade the quality of referral services. Consequently, this can raise the public trust to get treatment and medical services at domestic health facilities.
Orang Indonesia ini percaya sama dokter Indonesia. Kurang apa Indonesia? Pintar-pintar semua. Rumah sakitnya bagus-bagus semua gitu loh. Tetapi masih berobat di daerah di luar negeri sana.
Oki and Koko, TVR Parlemen report. The House has finally approved the draft law concerning the establishment of the Southwest Papua Province to be passed into law at the 10th plenary session for the session year 2022-2023. In the report submitted by the member of Commission 2 of the House, Gus Pardi Gaus explained, discussion of the bill had started since August 25, 2022. Gus Pardi hoped the formation of Southwest Papua would be the solution to ongoing conflicts in the region and accelerate regional development.
Kami berharap bahwa kebijakan otonomi khusus bagi Provinsi Papua tidak hanya dapat mengatasi permasalahan konflik, melainkan juga dapat mempercepat pembangunan di Provinsi Papua Barat. Adapun tujuan pemekaran provinsi di Papua berdasarkan pasal 93 Peraturan Pemerintah nomor 106 tahun 2021 tentang kewenangan dan kelembagaan pelaksanaan kebijakan otonomi khusus Provinsi Papua, pemekaran ditujukan untuk mempercepat pemerataan pembangunan, mempercepat peningkatan pelayanan publik, mempercepat kesejahteraan, dan meningkatkan harkat dan martabat masyarakat.
Commission 2 of the House also expressed the appreciation to the chairperson of Committee 1 of DPD, the Minister of Home Affairs, the Minister of Finance, the Minister of National Development, and the Minister of Law and Human Rights, who actively participated during the discussion of the bill. Raihan and Christio, TVR Parlemen, report. And that's it, the House News for today. Thank you for watching, and I'll see you in the next episode of House News only at TVR Parlemen.